Facial tics can be very, very hard on parents, but they're devastating to the children who deal with them. According to Livestrong.com, between 5 and 20% of all children experience facial tics at least once in their life. However, there's some children who suffer needlessly with severe facial tics. The result? Oftentimes teasing. It's a hard way to live, hard way to grow up. I'm going to share a personal story with you. I have a personal friend of mine who I've known for years. She knew I was a chiropractor and she knew what I do for a living and knew how I help children with all kinds of different problems. She contacted me in desperation. Her 10-year-old son, Dylan, suffered with severe facial tics. They started all of a sudden for no reason at about 8 years old. The mom brought this child to 3 neurologists, pediatric neurologists, 2 pediatricians, among others. Nobody had answers. The pediatric neurologist actually told the mom, if it were me, I wouldn't put this child on medication. The side effects were far too severe. So when she contacted me, she asked a simple question: can chiropractic help? Naturally, I said, of course. Take this child to the closest chiropractor that you can. She was a bit apprehensive, not sure about chiropractic, but wanting answers. And I said, if I'm ever down your way, she lived about 2 hours away, I'd be happy to take a look. I was down to speak at a conference pretty close to her house. I contacted her. I said, let's meet. I want to take a look myself. I couldn't believe how bad these tics were. It was the way she described it didn't even give it justice. I couldn't believe it. I dedicated myself to finding a reason. Now I'm going to share another story that really coincides with this. I'm an athletic trainer. Those of you who are athletes know what an athletic trainer is. If somebody gets hurt on the field, you see the athletic trainer run out on the field, tape up the joint, evaluate the joint, do whatever needs to be done. Now, interestingly, athletic trainers, among chiropractors, but athletic trainers especially, when we evaluate a concussion, we look at the cranial nerves. There's 12 cranial nerves in the upper part of the spine, right about here. The cranial nerves exit the spine. We can't see the portion. It's part of the brainstem, just above this bone right here. Now, as athletic trainers, when we're dealing with concussions, we evaluate those to make sure that everything's fine. That's how we decide whether we're going to let the athlete play again, keep them off the field, or make a medical decision. Interestingly, the 7th cranial nerve, it's called the facial nerve, does certain things for the body. For instance, if I'm an athletic trainer and I'm looking at an injury and I'm evaluating the injury, I'm going to ask the athlete to do things like squint your eyes, raise your eyebrows, smile. We're testing the cranial nerves. If one of those is abnormal, when you tell a person to smile, if you don't see the lips come up, we know there's a problem. Take them off the field immediately. Now, interestingly, when I looked at this child, Dylan, all of his facial tics had to do with facial nerve. Cranial nerve number 7. Everything that we test for, he was doing. And so naturally, I put 2 and 2 together and I said, this child needs to be adjusted. There's not a question in my mind. We've got to get him evaluated. And after a very simple, quick check of his upper spine, I realized that there were 2 bones out of place, this one and this one. We call it occiput and C1. They were so far out of alignment that any chiropractor, even a chiropractic student, could have figured this one out. I adjusted Dylan very safely, very gently, waited a day. Lo and behold, the tics went away by 90%. The father, who's a pilot for the sheriff's office, very, very responsible gentleman, he really wanted to see a change in his son, and he couldn't believe it. In fact, the first thing he said was, "We need to get him adjusted again. This is doing amazing things." The dad ended up driving 2 hours. Dylan got adjusted a second time. The tics stopped. I'm not saying they decreased, they stopped. Never happened again. So naturally, the mom and dad said, "Why didn't we hear about this? Why didn't the neurologist or the pediatrician refer us to the chiropractor?" It's hard to say why, but as chiropractic patients, we need to spread the word. Kids don't need to suffer. They need to get evaluated by a chiropractor. The facial tics changed this kid's life. Getting adjusted made him better. Now, by adjusting this area right here, you might say, well, what did we do? How did you just put a little bit of pressure on the spine and take away his facial tics? Well, we didn't take away his facial tics. We took the pressure off the nerve and allowed the body to do what it was meant to do. You see, when there's pressure on a nerve, there's a hypersensitivity. It goes haywire, simply put. So when we took the pressure off of that nerve, that abnormal signal that was causing those facial tics just simply stopped. So I wonder, how many other children out there? Again, Livestrong.com says 5 to 20% of all children. That doesn't need to happen. So I hope this helps you help others. If there's any other additional questions that you might have about facial tics or the occipital bone or the C1 bone, while you're at your chiropractor's office, ask him or her. They'll educate you even better. And together, we can change the world.